All right, again, good afternoon, everyone, and thank you all for joining us today. For today's webinar, my name is William Moore with OJJDP NTTAC, and today's webinar is supporting child welfare through mentoring, building effective partnerships. Again, I'm William Moore with the Office of Juvenile Justice and Delinquency Prevention's National Training Technical Assistance Center. And as your technical host, I would like to take a couple of minutes to discuss a few features to keep in mind during today's webinar. This webinar is brought to you in part by the National Mentoring Resource Center. Please note that this event is being recorded and will be published on NTTAC's YouTube channel. The webinar will be archived on NTTAC's YouTube channel, where you can also view past webinars. For the event transcript and supporting materials, please contact the OJJDP NTTAC Help Desk. For those wishing to download a copy of the PowerPoint slides and other important documents during today's webinar, you may do so by locating the handouts pod directly above the chat area. Here, you will also find an FAQ for webinar participants that will likely address technical related questions. Click on the name of the file and then click the download button. During today's webinar, presenters will address questions during the Q&A segment. Please type your questions into the chat box as they arise. For those of you participating in today's webinar as a group, please take a minute to help us count. Go to the chat window and type in the total number of additional people in the room with you today. If you are viewing alone, there is no need to type anything at this time. For those of you who already did that earlier, thank you very much for doing so. For our new guests, again, if you are viewing in a group, please take a minute to help us count. Go to the chat window and type in the total number of additional people in the room with you today. And I'll give folks just a couple more seconds to do so. Following today's webinar, attendees will receive a certificate of attendance. This certificate is sent approximately 1 hour following the conclusion of the event and is sent via an Adobe Connect thank you email. Please keep an eye out on your certificate. Please note that only participants that are registered and signed in will receive a certificate of attendance. At the conclusion of today's webinar, you will be provided with a link to a brief evaluation about today's presentation. The feedback you provide is used to assist in future planning and training. I will now turn the webinar over to our moderator, Melissa English, for today's presentation.
Thank you so much, William, and hello everyone, and thank you so much for joining what I'm sure is going to be a very rich, informative, and valuable webinar. Like William said, my name is Melissa English. I'm a program manager at Mentor, the National Mentoring Partnership, and I'm the project lead for the National Mentoring Resource Center. April is National Child Abuse Prevention Month, which is an annual observance that focuses on promoting the social and emotional well-being of children and families. It's a time for communities nationwide to encourage action, and raise awareness about the importance of families and communities really working together to prevent child abuse and to improve the safety and well-being for all youth. Sadly, according to the Department of Health and Human Services report, 3.5 million children were the subject of at least one maltreatment report in fiscal year 2017. OJJDP is partnering with the Department of Health and Human Services and other national child welfare agencies to promote community partnerships and support efforts to address child abuse and neglect. And so to that end, the National Mentoring Resource Center, in collaboration with OJJDP, wanted to do this special webinar highlighting the ways in which mentoring organizations can really partner with child welfare agencies to serve youth and families in the system or, those at risk. And so today we have 3 amazing mentoring programs we'll be highlighting that do excellent work in this space. And I'm so thrilled that they'll be sharing their insight, their best practices with you all over the next hour or so. So without further ado, let me start by introducing our panelists. First up, we have Carmi Brown, and Carmi is the Chief Program Officer of Friends of the Children. I'm going to switch the slides there. She has worked in the human service field for the past 18 years, with most of her work being in the area of child welfare. Carmi began her work with the Friends of the Children in 2014 as Program Director of the Friends of the Children site in Tampa Bay, Florida, and joined the national team as Chief Program Officer in 2018. So thank you for joining us, Carmi. Next we have Leah Feroz, and Leah is the Mentoring Director at Family Services of the Merrimack Valley in Massachusetts. She has 17 years of experience working in the human services, 14 of which in the mentoring field. Leah is currently responsible for implementation of 4 mentoring programs serving over 300 youth at Family Services of the Merrimack Valley, and serves as the project director for the Massachusetts Success Mentors Collaborative. And thank you so much for joining, Leah. Finally, we have Chris Hultquist. Chris is the executive director of the Mentor Connector, a Rutland County, Vermont-based organization that creates positive change for youth and families through the power of one-on-one mentoring. Chris possesses extensive experience managing programs dedicated to serving vulnerable populations and enhancing community sustainability. Throughout the past 15 years, Chris has worked with multiple counties across the Northeast to create innovative collaboratives to improve the health and wellness for youth around there. And thank you so much for joining Chris. So again, thank you to all our participants. Please know that hopefully we'll have plenty of time for Q&A at the end of our 3 presentations. So please don't hesitate to send your questions in as we go along, and we'll collect them and share them out to the panelists at the end of the Q&A time. Now I'm going to turn it over to Carmi with Friends of the Children. Take it away, Carmi.
Good afternoon. Again, I bring you greetings from Friends of the Children. And over the next few minutes, I will discuss a little bit about who we are, who Friends of the Children is, and the work that we've done in expanding our model and our ability to partner successfully with child welfare agencies in the mentoring space. So who are we? We are a national nonprofit long-term mentoring program. We're based in Portland, Oregon. However, we're located in several locations, 15 locations across the country and 1 in the UK. And I'll talk a little bit more about our model in the coming slides. Again, we, like I stated, we're a national nonprofit, and we say that we like to, believe that we are able to break the cycle of generational poverty by giving children that are facing the highest risk the ability to create a new story. And when I talk to people across the country about that, they go, whoa, that's pretty lofty, right? But we, and I'll talk later about some of our outcomes and the way that we measure the work that we do, but we're really able to, identify youth that are in their very young youth, ages 4 to 6, and we select these youth either from the foster care system or from high poverty schools. And because we're able to provide this long-term salaried professional mentor, and we call our mentors friends, to these youth for such a long period of time from kindergarten through their high school graduation, we're actually able to really help these youth again create a new story. On this slide, you'll see our 3 long-term outcomes. The first one is that we are looking for all of our youth to graduate high school, and we've been really successful in that. 83% of our youth are able to graduate high school. 93% of our youth are avoiding the juvenile justice system, and 98% of our youth are avoiding early parenting. And we chose these 3 long-term outcomes as a measurement of our success because these are indicators for future success for these youth in their life. And what we find is we identify youth that they're coming from situations and circumstances that would otherwise maybe not yield the same results. And I'll go into, again, some more of the stats and how we select our youth and what some of the outcomes that we're able to achieve given their current situation or circumstances. And I like to, not leave off that, regardless of what happens or what's going on in the life of the youth, again, we're serving them from kindergarten through high school graduation for 12 and a half years, no matter what. And I think that piece is really important. We typically select youth that other programs maybe are not wanting to or not able to maybe maintain that youth in their program for a number of reasons. We are willing to work really intensely with the youth, their family, their communities, and their schools so that we can continue to serve that youth for the duration of their school career. So unless a youth moves outside of our service area, we continue to serve them no matter what. Our model is a little bit unique. Again, we look for youth that are impacted by trauma, such as foster care. Again, our mentors are salaried professionals, so they're not volunteers. So again, another piece that just sets us apart. I mentioned the 12 and a half years no matter what. Again, there's nothing that a youth can do to get kicked out of our program. And we work, again, we serve our youth 2 hours in their schools and then 2 hours in the community, and we work very closely with their caregivers as well. And another piece is we're really big on really evaluating and measuring the work that we do so that we can look to improve, services and outcomes for our youth. So I thought I'd talk a little bit about how we select our youth because it then will tie into how we were able to partner with our foster care and child welfare systems across the country. So our child selection process is a very interesting process, and we partner with schools that have a very high number of a high poverty rate, where a high percentage of the youth that attend that school are receiving free or reduced lunch. And what we do is we go into the kindergarten classroom and we sit and we observe for 6 weeks. And we look for those youth that are either really withdrawn or youth that are having extreme behaviors. And we do an entire assessment that I'm not necessarily going to go into, but essentially we look for youth that have the highest risk factors. And I listed a few of those on the right side of this particular slide. So those that are having the highest risk factors and the least protective factors as listed on this slide. And those are the youth that we look to bring into our program. So after those 6 weeks, we have a meeting with the school, and we have a rating system where we rank the youth, and we look for the youth that score the highest. Again, those with the least protective factors and the most risk factors. And then with the school's help, we work with the families to enroll the youth in the program. So that is kind of our traditional model. That is what we have been doing for 26 years since the inception of our program, and it's been really, really successful. And what we found is, even in our traditional selection, about 30% of the youth that we serve were foster youth. So that is an interesting stat because we were having the same impact we found on the youth that were experiencing foster care as we were on youth that were not experiencing foster care. So about 6 years ago, we were approached by multiple partners saying, you guys are really making a difference in kids' lives, regardless of their living situation, regardless of the circumstances in their environment or their family life, but you're still having really successful outcomes. So we decided at that time that it made sense for us to really expand into the foster care, expand our model into foster care. And so what we did is we decided to select youth from the foster care system directly. So as opposed to our traditional model of sitting in the classroom and observing for 6 weeks and partnering with school districts, we identified that we could have this huge impact on youth in care, as we were already having with 30% of our youth, by partnering with child welfare agencies to help us identify youth that were in the age range that we were looking to identify, that 4 to 6 year old age range and identify youth from that system versus through our school districts. And what we found was that, again, the youth that were in our program, so youth that had a friend or a long-term mentor, they were experiencing the same outcome as the other youth in our program. Youth that are in foster care that are not in our program, their outcomes are just not as good, unfortunately, and I'm sure most of you are aware. So, where we have 83% of our youth graduating from high school, youth in care without a friend or that are not in our program are only experiencing graduation rates of about 55%. Same with the juvenile justice stat, youth that are in foster care that are not in our program, 63% are avoiding the juvenile justice system, and only about 86% are avoiding becoming early parents. So we recognize that, we were having, again, this great impact, and it made sense for us to, partner with child welfare agencies so that we can begin serving additional youth from the child welfare agencies. So some of the innovation and how we partner with child welfare, we conducted a feasibility study, and we, looked to explore, what expansion to foster care looks like. This, again, was new territory for us. And again, like I said, we found that 30% of our youth were already in foster care. So, okay, so we're already serving youth in care. And we identified, again, that the long-term outcomes were the same. So this really validated our ability to expand in this area. And so we were able to get funding from OJJDP, and we were able to really build out training and build our capacity to be able to serve more youth that are either experiencing foster care or at risk for foster care. So this was, again, really a way for us to just, do the work that we're doing and be able to serve another population of youth that could really use a friend, as we say. So again, what that looks like, we have to kind of adapt our process. And so what does it look like if we're not, observing for 6 weeks? So we had to kind of modify the way that we approach selection with keeping, certain fidelity to our current model. So we had to build out, trainings around how do you navigate these systems, because that was a little bit of a new area for us. We had to teach our friends how to communicate and navigate through some of the systems that maybe they hadn't touched. And, for those that, work in the child welfare system, it is a, it's a beast of itself. And we have to, we wanted to make sure that our friends were really equipped in order to be able to serve and communicate with and be able to really partner with the child welfare agencies and also advocate for the youth within these systems, because unfortunately, youth experiencing foster care sometimes don't really have a voice. So and a big thing that we do at Friends of the Children, we really believe in youth voice, and we wanted to really ensure that we were properly equipping our staff and our friends to be able to do so. And we had to establish a learning community. And yeah, the formal partnerships were huge so that we could really work through what these partnerships would really look like. And so the partnership, I'd say the elements of the successful partnership with child welfare agencies, the big thing is the mission and message alignment. If your organization really aligns with the federal guidelines or federal outcomes for foster youth, which are safety, permanency, and well-being, then you're more likely to have a successful partnership. And we found that we were doing that. These are things that we focus on. These are things that we were already measuring. Again, the MOU is really important because it really was able to spell out what the partnership looks like. What is it that we're asking from them? What will we give them, et cetera, et cetera. And then just really follow through and proactive communication. Unfortunately, child welfare, specifically some of the caseworkers and some of the staff that are really out doing the phenomenal work that they do every day, the turnover is sometimes a little bit high. So we had to make sure that we continued to communicate with them, and we understood and we continue to understand the nature of the work that they do and how busy their jobs are, and while they were super excited about the partnership, we understood that we had to continue to be really proactive with communicating with these agencies. Again, other areas that we, found to be really successful or important in the success of the partnership, we share it with them what our selection process looks like, and we really had to establish protocol so that the child welfare agency could give us the youth that really fit our criteria with the higher risk factors and least protective factors. We really, again, work with them and help them to understand how we want to involve everyone in that child's life in this process, the biological parents, the current caregivers, the schools, the caseworker, and we wanted this ongoing, very engaging kind of relationship to be established with all of those that are involved in that youth process, in that youth life. And we wanted, permission from all of these folks. We wanted to give those biological parents that still had their parental rights intact, the right to say, yes, I would like my child to join this program. I understand it's voluntary, and I do understand that regardless of, if I'm reunified with my child or not, that my child has a space in this program for 12.5 years. We also, developed a reporting system so that we can report out to the child welfare agencies what exactly we're doing. We, like I said, we measure. We have tons of work. We have tons of data, around the work that we do. Every time our friends are with the youth, when they come back into office, they're recording their time with that youth around all of the different measurements that we've established. So we wanted to share that with the child welfare agencies because we knew that they would find that valuable. And they would oftentimes then share it with the court systems and share it with others, and we would share with the families. We just wanted, again, this very open line of communication. Also, we were, again, just really vigilant in really sharing on building those relationships with the staff and the leadership. So that was really important. And again, I've mentioned a couple of times, we are very much a data-driven organization. I have a small snapshot on the right side of this slide of our program scorecard, our program performance scorecard. So we have a monthly, a quarterly, and annual scorecard that really reflects the work that we do. So once our friends enter information into that database, then these different reports are then produced. So we're able to really kind of reflect on the work that we've done, adjust the service, and essentially ensure that in the long run, our youth are able to achieve our short-term and intermediate outcomes as well as the long-term outcomes that I shared with you earlier. So we really, again, are really big on collecting and using the data that we collect. Oh, I'm sorry. I think I just clicked off of the presentation. So I'm not sure if you can still see.
No worries. We'll go ahead and I'll work to get that reloaded here. Give me 1 second. And yeah, I think you may have stopped the sharing the presentation, but no worries. We'll reload it.
Okay. Thank you, William.
Sure. My pleasure. Should be reloaded shortly.
Okay. Thank you so much. And I won't know that I need to allow my other presenters time to present. So the last thing I just wanted to review is we have lots of studies that really help to measure and evaluate the work that we do. These are really important to us. The one that I say I will point out is the qualitative caregiver support study. And this was, supported by Annie E. Casey. And it really helped, the result of this, it really helped us to identify what the caregivers and the caseworkers felt the impact was with our friends working with these youth. And essentially, they were really appreciative of the services. They wanted more of it. They felt that the impact was huge, and the improvements that they were able to see in these youth were what they really noted. And the caregiver's ability to connect with the youth that they were caring for improve through the relationship with our mentors. So we found that in that study as well. But I know that I'm out of time, and we will have time for question and answers at the end. So again, thank you for the time, and I will then pass it on back to you, Melissa.
Great. Thank you so much, Carmi. And that was great. We do have a bunch of questions, but we're going to save that for the Q&A time. But thank you so much for sharing with us. Now I'm going to turn it over to Leah Feroz from the Family Services of the Merrimack Valley in Massachusetts. Leah, take it away.
Thank you, Melissa. Hi, everyone. I'm Leah Feroz. I'm the Mentoring Director at Family Services of the Merrimack Valley. So I'll start by just telling you a little about Family Services and what we do. We're a social service agency located in Lawrence, Massachusetts that seeks to give children and families the knowledge and skills necessary to overcome life's challenges. We do that by providing over 20 programs that fall under 3 main categories. Under our youth development umbrella, we have our mentoring program, our CASA, or Court-Appointed Special Advocate Program for children in DCF custody, as well as programs that teach life skills and sex education for youth. We have a number of parenting programs as well, one specifically for teen parents, another specifically for fathers, one for couples seeking to improve their marriage. We have a mental health clinic that provides counseling services, in-home therapy, therapeutic mentoring. The Samaritan Suicide Prevention Program is a part of Family Services as well. We provide employee assistance as well as trauma response services. We're also the Family and Community Resource Center of Essex County in Massachusetts, which partners with the Department of Children and Families to provide a host of services that help families raise children in healthy, stable homes. So we do a lot, but I get to focus on youth mentoring. So we have 4 mentoring programs at Family Services with a little over 300 active matches total. So it's a significant part of what we do and plays an important role in child abuse prevention. I know I would be preaching to the choir, so won't get into the positive outcomes that we all know come with mentoring too much. We know it strengthens child and family protective factors. We heard Carmi talking a lot about that, and I figured that would be a theme today. So we know it does this by helping to build resiliency. It promotes positive youth development by increasing the social and emotional competence within our youth. We know that mentors become an additional resource for support and guidance, expanding the child's web of support, because we know that the bigger that network, that child's network of caring adults is, the greater the chances they will get what they need to overcome obstacles and develop the life skills that will help them be successful in life, because no one person can do it alone. In our programs, some mentors, but certainly staff, become additional support to parents as well, connecting them with resources, providing education, or at the very least, reducing isolation, because now we are in it to a degree with them. Another way our programs play a role in child abuse prevention is by promoting partnerships and collaboration, because we feel that just as the mentor can't do it all alone, neither can just one program. And I think that mentoring programs have a unique opportunity to do this because of the nature of the mentor-mentee relationship. Our matches here at Family Services are all one-to-one, so mentors have the luxury of focusing on only one child of developing a close and trusting relationship with one child. So they're often the best advocates. And we as program staff serve as the conduits, bringing important information to the attention of schools, clinicians, or social workers that may otherwise be missed. Ideally, we even have the opportunity to participate as active partners in discussions around solutions or have the ability to make referrals ourselves when there are gaps in services or the family has additional needs not currently being met. I'll talk a little more about our specific programs and partnerships. As I mentioned, we have 4 distinct mentoring programs. Big Friends, Little Friends is our community-based program, which used to be Big Brothers, Big Sisters of Greater Lawrence. We serve kids between the ages of 6 and 18, sometimes a little older even. Stand and Deliver is our academic mentoring program. It's site-based, corporate campus model, which means we transport Lawrence Public School students once a week to one of our partner companies where they meet one-on-one with an employee who's a volunteer mentor at that company, and they work together on academics or anything the child needs help with. And that's 8th grade through high school. The Massachusetts Success Mentors Collaborative is one of our newer programs, OJJDP funded. It's school-based and serves chronically absent students or those who are at high risk and demonstrating the risks to are already becoming chronically absent. The Success Mentors Collaborative is unique because we partner with 2 organizations on the other side of the state, Holyoke Boys and Girls Club and Springfield School Volunteers. Each organization running its own Success Mentors program with the help of Mass Mentoring Partnership, who provide training, technical assistance, and act as the conveners of the collaborative. So as partners on this grant, we get together in person quarterly and monthly by phone to share our experiences, brainstorm challenges, and really learn from one another. It's been a great experience, and we're seeing real impact for our mentees. And finally, our Amigos program is our newest program, and we're still getting up and running. This program is for court-involved youth, and we're partnered with probation, the police department, and 3 schools for that program. And that's going to be a combination of community-based and school-based. So each of our programs has a different model, but all align with and in some cases exceed the standards set forth in the elements of effective practice for mentoring. So I'll talk a little about some of the specific things that we do that we feel contribute to supporting safe and healthy families. We have a thorough enrollment and screening process for mentors, youth, and parents. We conduct in-person interviews with each party and contact collaterals such as DCF, therapists, or guidance counselors when they are involved with a child. This is an important part of the enrollment process for us because it allows us to get a complete picture of the child, to get a professional's opinion on family dynamics, current risk factors, and it gives us a better sense of what, if any, supports are already in place and what additional ones may be needed. It also sets the stage for future communication with the other professionals involved with the family. The more information we get at the outset during enrollment, the better the match we can make and the better we can prepare that mentor. And the more people that we know of in that child's life, the greater our ability to support the match and the child moving forward. We also have a comprehensive 6-hour mentor training that include information on child development, and trauma. So our mentors are equipped and feel prepared for the experience ahead of them. We feel really fortunate to have had MMP as a partner and technical assistance provider for our Success Mentors program and have really benefited from their training expertise. So we've been able to carry that over to our other programs as well. Monitoring and supporting matches is incredibly important, as we all know, and we feel that parent engagement is an essential component of that. Our mentoring programs engage parents and caregivers at every stage, from enrollment through ongoing match support. Parents are invited to kickoff events, holiday celebrations, and summer outings. Our staff work really hard to develop relationships and establish trust. And because of that, we have great turnout. During the holiday season, our agency receives a substantial amount of in-kind donations from generous community partners. So many of our families receive gifts for each child in the home through our programs. We distribute Thanksgiving dinner donations as well. This obviously lessens the financial burden and stress during the holidays for many of our families, which is great that we can help in that way. Consistency and frequent contact helps develop strong relationships. We know that. And this goes for matches, parents, and partners. So matches in 3 of our 4 programs meet once a week, on occasion every other week, for a total of 6 to 8 hours a month. Our staff contacts mentors, parents, and youth twice within the first month and monthly thereafter for the first year of the match. Our Success Mentors program exceeds standards in this area. So I'll talk a little bit about that. The mentors in this program are primarily school personnel, and we ask them to have 2 to 3 touch points a week with their mentees. Mentors receive 5 touch points a month from our staff in the form of weekly texts or emails, as well as an in-person meeting once a month. Mentors and staff in this program also reach out to parents once a month, taking a strength-based approach and giving positive feedback each and every time, which, again, given that our mentors in this program are primarily teachers, getting calls home with good news is often a brand new experience for all involved, teachers as well. So parent engagement and that feeling of school connection and belonging is definitely being strengthened for youth and their parents in our Success Mentors program. It's pretty awesome. Another unique piece to this program is the high level of school support and participation. Each participating site, Lawrence, Holyoke, and Springfield, have active partnerships with at least 2 schools, and each program coordinator receives a weekly attendance report from the schools for participating students. And they meet to review the data every week or 2, identify students who need additional supports in place, and discuss trends that could potentially have school-wide implications. The schools also provide office space so that the program can really develop a presence at the school. And we keep consistent office hours for mentors and students to drop in. We feel really fortunate to have such strong partnerships with schools, court, DCF, and other community service agencies. We're lucky to have so many programs and family support services in-house at Family Services. Our agency was founded in 1854, so we've been around for a very long time. But we still have to put a lot of effort into developing and cultivating relationships and making the time to showcase the success of our programs, which is time-consuming, right? Often takes the back burner to day-to-day tasks and fires that we're all putting out. So, but in my experience anyway, it's often what leads to the development of informal and formal partnerships, collaboration, and most importantly, more comprehensive services for the youth and families in our program. So I'm going to pass it along now.
Thank you so much, Leah. That was great. And, you know, I mean, you all are doing great work up there. Well, I'm in Boston. You're up in Lawrence there. So thank you so much. And now I'm going to, and we're going to be keeping track of the questions. So keep those questions coming on in. I know there's a couple of questions from folks about this being recorded and sent out, and it will be recorded, and it's available on the NTTAC website, but we'll be following up with some information on that in the handouts pod there. So next up we have Chris Holtquist, the Executive Director of the Mentor Connector. Chris, take it away.
Thank you so much, Melissa. Hi, everybody. I'm Chris. I am from Vermont. So anybody who hasn't been to Vermont, you need to come visit, first and foremost. So I run the Mentor Connector here, and we are a community-based mentoring organization. So we mentor youth and families, about 150 youth and families across the southwestern Vermont. And so we really target youth, as many programs here probably listening, we target vulnerable youth, and we consider youth vulnerable who are in foster care, single-parent families living in poverty or connected to drugs, alcohol, or violence. So that's kind of our catchment area, although we will serve any youth that can be safely placed in the community as well. So the youth that we serve account for about 60% of the juvenile justice and suicide attempts in the region. And so that's really why we kind of target that range. And then to be able to be successful with those youth, we've created mentoring programs that work with youth in foster care, children of incarcerated parents, pregnant and parenting teens, youth in diversion, youth at risk for high school dropouts, and youth and families affected by opioids. So that's a whole bunch of different programs that we run, and they're basically the training is a little different and support is just slightly different, but really all of these programs support youth who are struggling throughout the region. And each of our mentor matches focus on kind of 3 areas. So the first is life skills, the second is educational curiosity, and that's increasing curiosity about the workforce, really about who they are in life, and that really spills over to academics. And then the third is workforce development. So those are kind of our 3 areas. And so I'm going to give you kind of an overview of why Vermont is here talking about child welfare, and then kind of go into some best practices of what we've learned over the past handful of years working with youth. So really within Vermont, one of the things that we've seen is that we've had, since 2014, we've had an increase in opioid overdoses about 251%, which is incredible. And really what we've done is that a lot of people came to the table and really started talking about this years ago because of the increase. So because as a result of that, the number of youth in foster care have risen 42%. And then originally it was under the age of 9 was the rise in foster care. And over the past 2 years, they've really seen the rise in foster care being between the ages of about 9 to 12. And so what we're seeing is we're seeing a huge increase in the number of youth that are referred to our agency. And really, we've been having to work really closely with our child welfare agency, with our foster care system, and with the community to really prepare our mentors for what the youth that are coming to us and the challenges that they have. Along those lines, we've actually seen the ACE score in our youth increase dramatically as well. And so So as a result of that, we actually started working with Prevent Child Abuse Vermont, which is a Vermont state agency that does a lot of technical assistance and training. And we worked with them to create a training module to really help us prepare mentors to work with specifically with youth in the foster system and to kind of help those mentors understand what it's like to be in the foster system and what are the challenges that those youth need. On top of this, we created a family mentoring model. And what this family mentoring model is that we work with families that are going through opioid abuse. So one of the parents are in recovery, and they're at a high risk for child welfare to being involved with the family. And so we actually have a community mentor that works with the family unit, so the parents or the guardians for up to 12 months. So they work on sustainability and providing that support. And then every youth in that family gets their own mentor. So we could have a team of about 5 mentors that work with one family. And that is all supervised by a clinician that we have come in to really work with all of the mentors on boundaries, on making sure that all of the family is supported in great ways. And so all of those kind of combine to really help support families who are on that at-risk side. So since we've been doing this for about 14 years now, and really what we've seen is I'm going to just give you 3 of the lessons that we've learned. I'm sure that lots of you out there have your own lessons that you've learned as well. And so I'm just going to give you a handful of different lessons that we have learned throughout the past few years, and kind of some tidbits to take away. So the first is being at the table. I think that one of the challenges that we have within the mentoring field is that we're still a very young field. And so oftentimes we've seen within professional settings that mentoring is not necessarily seen as a viable or really a validated, cost-effective resource within the kind of the community mentality. And so therefore, us as an organization being at the table, what that does is that not only helps us work closer with the child welfare system, but it really helps our mentors be able to work and be seen as a strong resource to the table. And so really, we want our mentors to be able to have the resources and to be able to be connected as closely as they can to whether it's the foster system or the foster parents. And so we really work very closely with the system to make sure that our mentors are seen as a validated support. And so one of those things is that we go to community meetings, but we also meet. We actually, as an agency, we go to here in Vermont. It's DCF, Department of Children and Families, and so we actually go to meetings on a monthly basis where they talk about different cases or where they talk about kids that we're serving. And so we are actually at the table to really be seen as a community resource long-term for a lot of these youth. And so a strategy that I would suggest is just to choose a couple meetings to attend, if you aren't already, and just be a fly on the wall at first, and then really start working with your partners. And then the second lesson that we learned is to get buy-in from foster parents. What we saw is that one of the challenges is that we have a lot of kids in the foster system who end up moving between a lot of different foster homes. And the challenge that we see is that as they move from home to home, we then have to reestablish kind of that connection with those foster parents. Because just as in traditional mentoring, you end up getting families who, you have to get buy-in from the parents. Well, that's the same thing with the foster system. And when they move to a new foster home, we need that buy-in from the foster parents to make the match successful. And so we actually go and we meet with the foster parents. So each time we find out that a youth moves foster homes, we actually go in and meet with the foster parents, and we have a packet of information that we bring them it's just an overview of the program and really the benefit of the program and how it serves that youth. One of our youth has been matched for about 6 years, and during that time she's been in 5 foster homes. And traditionally it's really hard, especially when they're in foster homes and we don't know. And that's, that kind of goes back to point number 1, just being in the know and being at the table. But really just making sure that that we are always connecting as much as we can with those foster parents to teach them what it's like to be a mentor, what that mentoring relationship is and the benefit that it serves, and then really provide them that information around that. So if you have that 1 to 2 page overview of your program, I would say bring it with you and go in and meet with the foster parents each time. And if not, then easily create a 1 to 2 page. I'm sure that most of us probably have that to be able to bring in and just kind of share as you meet with the foster parents. And oftentimes we bring food. I mean, in reality, when you bring food, it opens up the door so much easier. And so the third point that we have is really building community around youth. What that does is that we know that we kind of all know the statistics of youth who are in long-term foster situations. I'm going to name a few, but these are probably common to most of us. So youth are 4 to 10 times more likely to commit a crime. 1 in 4 will develop PTSD. They have a higher chance. 7 times more likely to be addicted to drugs. And we know that that's one of the challenges, and that's why we're around. That's why we in mentoring, why we work so closely with the foster system is because when we match those additional community supports, we know that these stats change. And so one of the pieces that we do and we work very closely with is to build that community around the youth, because the mentor match isn't necessarily going to last forever. But if we build a community and build those connections around youth, then oftentimes those connections can last longer than the mentor match does. So for example, we have one match, John and Zach, who are in a rural part of our county, rural part of rural Vermont. And so basically after a couple months of being matched, they didn't necessarily know what to do together. So they ended up going to the downtown of their area and just going store to store and just meeting the individuals who were there. And so after a while, what happened is that Zach actually got to know every single one of the store owners, and that really built this community around Zach. That actually, when he ended up moving his placement to a new foster home, which was still in that area. But what happened is that he still got to know all of those individuals downtown, and still to this day, I mean, I think that happened about 3 years ago, and still to this day, when he walks downtown, he actually gets to, they all kind of stop and they say hi to him and they ask him how he's doing, and he's really connected with other people around. And so we try to expand youth community by exposing them to different people of support, whether it's the mail carrier or the person working at the supermarket or a faith leader, really making sure those connections are expanded. And especially for youth in the foster system or youth who are at risk of being in the foster system, just expanding their community so that they have multiple people who are they're connected with. Another strategy that we use is that we actually connect our matches together. And so we, not only through our group mentoring, so we do each month we do activities that we actually bring everybody together with, but on top of that, we actually connect our matches together. So oftentimes if we have youth who are struggling with similar obstacles, or if we or if we have matches that are kind of struggling in a certain way, we'll actually connect them with other matches, because then you have an additional mentor who can kind of speak into that youth as well. And so that's one more way of just expanding that youth community and having another person in their life who can speak into them. And so a strategy could be to have an activity and connect some matches that don't naturally connect, or it could be just to really have that community model start moving from an individual kind of match standpoint to more of a community-based model could be another strategy. So those are just a handful of strategies that we've used and that have worked over the past few years to really connect and work closer with youth in the foster system and help them help provide additional layers of support on top of just the traditional one-on-one mentoring so that the mentoring can be even more successful. So that's it, and back to you, Melissa.
Thank you so much, Chris, and thank you to all our presenters. This has been phenomenal and really, really, really rich. I've gotten a lot of questions, so I've been kind of triaging them along the lines. And so I'm going to ask the first question to Carmi. When you say risk factors and protective factors, are these specific to child welfare? The risk and protective factors for what?
So they are not necessarily specific to child welfare. This is a great question. So what we look at is we look at environmental as well as child risk factors and environmental and child protective factors. So some of the child risk factors are low self-esteem, social withdrawal, aggressive behavior, poor social relationship skills with peers and adults. And then the environmental factors are a number of things, single parent home, family living in poverty, involvement in foster care, parent with criminal history, and we're talking about the birth family, parent currently or was incarcerated. So those are some of the child and environment risk factors. And then the protective factors are, high intelligence, demonstrate self-efficacy, healthy self-esteem. And then for the environment, protective factors would be they have, a warm relationship with at least one caring and consistent adult, or really strong positive family traditions, intergenerational strength. We look at a number of factors when we look at those risk and protective factors, again, for the child as well as the environment.
Perfect. Thank you so much, Carmi. And I'm going to go to Leah next. Leah, for someone would love to know more about the 6-hour training. Can you speak to a little bit about that and about the mentors and the teachers that are going through the training and when they actually go through that training?
Sure, yeah. So because we have 4 different mentoring programs, each training, looks a little bit different. And depending on whether or not it's site-based or school-based or community-based, we feel that mentors in those different models need different types of training, of course. So for our community-based program, we have 2 nights of mentor training, and we've enhanced it and tweaked it substantially over the years, really consistently trying to improve it and meet the needs of our volunteers. And so, we talk about the role of the mentor. The youth that we serve takes up a good portion. Going in depth about on child development and cultural awareness, trauma. We highlight case studies based on real failed matches to really bring things home to people. We spend a good amount of time talking about expectations and doing some activities around that, because we know that mentors' unrealistic expectations can be a big predictor in the stability and the success of a match. So we talk about communication. So, as I mentioned during the presentation, Mass Mentoring Partnership has been a huge asset, and I know not every state, I don't believe every state has a strong, state partnership through, as a mentor affiliate, but we do. We're lucky in Boston, and another resource. So they've been a great resource, and another resource I think is the National Mentoring Resource Center, which I know, Melissa, obviously you can speak to that and all of the resources and the abundance of material and expertise just at everyone's disposal there. But as far as the Success Mentors question about when our mentors, get training, and I believe I saw another question about when they meet with their mentees. So that program, we do ask mentors to stay after school a few times a year, and we're able to get food donated to help with that, because Chris is right, that makes a big difference for people. And so that's when they get their training. As far as the matches connecting, though, 3 times a week, it's during the school day usually, but some mentors do come a little bit earlier to connect with their student, or stay a little bit later to make those 2 to 3 touch points a week. So.
Awesome. Thank you so much, Leah. I really appreciate your take on that. And so the next one I'm going to toss over to Chris. And folks, keep on sending in the questions. We're getting a ton of them, but this is a really rich dialogue. We have these presenters here for at least a little bit over 20 minutes more, so we got enough time for really rich discussion here. So Chris, do any of the programs discussed include a peer-to-peer or near peer-to-mentor component?
That's a great question. So we, as an organization, we do what we call a triad. And so what that is that after a mentor match has been established for about a year, we actually, we encourage them to take on a youth. So oftentimes what we'll have is that if we have somebody who is either in later middle school or high school, we will encourage that match to then take on a third, it's like a third person or a triad, which is somebody in elementary school. And so it'll actually encourage the youth in the original match to then become a mentor. And that has been seen as kind of a sustainability long term, because then actually as that high school youth gets and ends up going into college, they can actually stay connected with that younger person longer term. And so that's kind of how we do more of a near peer-to-peer, so a youth model, but we don't necessarily work with, even though we work with schools who have peer-to-peer models, in and of our program, we don't have a peer-to-peer model program that we run.
Wonderful. Thank you so much, Chris. And I'm going to ask, Leah, do you have any mentoring peer-to-peer models such as we were just asking?
No, we actually don't yet have a peer-to-peer component to any of our programs. All adult mentors. Okay.
And I believe, Carmi, that's the same model that you work with, correct?
Correct. We do, okay. When our youth reach adolescence, we do group programming with them, as well as we do spend a percentage of our mentors spend a percentage of their time doing like group outings and some group activities with them, but we do not have the peer-to-peer component per se.
Okay, great. Thank you so much for clarifying. Chris, I just got one about the juvenile justice system. So how do you foresee your program transitioning services to youth in the juvenile system?
We actually work very closely with the juvenile justice system here in the region. We actually have a funnel system, so we work with the court system and the diversion program here in the region, that when youth go through the court system, mentoring is one of those components that they can actually access. And so when youth choose that, we actually match them as soon as possible while they're going through the system, and that the mentor then actually walks with them through the, whether it's diversion or it's the juvenile justice system. And so we train, we have an additional training component for the mentor so that they understand the whole system, how it works, and kind of all the ramifications. And then we then have that mentor that walks for a minimum of a year with that youth through whatever those follow-ups need to be. And so we've seen a lot of success with that program. One of the challenges, of course, that comes into it is that we run a voluntary program. So youth have to want to choose to be in the program, but we've had great success with youth who've been through that. We also kind of go the other way as well. If our youth ever are involved with juvenile justice after they've been mentored, one of the things that we have is that we have a contract with our workers that, with our court system, that we actually can provide additional support for those youth through the mentoring process. And so we actually have additional training and additional support systems through the diversion program that can provide those additional supports for both the mentor and the youth.
Wow, that's great. Thank you so much, Chris. So our next one is going to start out with Carmine. You spoke to how mentoring organization connects with the Child Welfare Agency and how Mentor connects with foster parents. But this person is wondering about any work or connection with the Child Welfare Agency or caseworkers.
Yeah, so we find that relationship is just as important as connecting with the foster parent or the caregiver. Like I stated, with the initial selection of our foster youth, we are heavily, involved with and in communications with the foster care child welfare agency. And then once we actually identify the youth that we're going to serve, the relationship with that child welfare worker is vital, because when kids are moving from home to home or things are happening in the dependency case, the child welfare worker is who is informing us as to what's going on. They're also really appreciative of the information we're able to provide them. Again, our mentors are in the schools for 2 hours a week, as well as the community with each of our youth individually. So because they have we place such a high emphasis on that relationship with the school, we're able to really be able to kind of relay and play as a liaison to give information back to the child welfare caseworker. So we also, again, provide them with a monthly report on all the activities that they've worked on around the goals that we have set for them in our program. So yeah, we believe that the relationship with the caseworker is just as vital as the relationship with the caregiver, because again, that caseworker is going to be able to help inform us of any changes that's happening in the life of the youth that we are not aware of from a legal standpoint around the parents and their dependency case.
Wonderful. Thank you so much. Leah, I'd love to hear from you as well. Do you partner, does your organization or the mentoring programs partner with any of the child welfare agencies' caseworkers?
So our program serves youth who aren't all in the child welfare system. Some of them, of course, are, but it's not a requirement. Each program is a little bit different, so for success mentors, we target youth who are chronically absent or at risk for becoming so. So we really look at data to determine eligibility for that program. So the student's attendance data is what we start with. And then, through our outreach with families and through the referral process for all of our mentoring programs, we always ask what other agencies are involved with the child and family. So, the referrals at times will come from the department themselves, the Department of Children and Families. At times referrals will come from, guidance counselors and sometimes parents themselves. So we're always asking those questions, and then we get the contact information and reach out to whichever collaterals are involved, and we just start, gathering information really for our own purposes, and to just start, developing that relationship to continue throughout the course of the match so that we can, best support everyone involved. So.
That's great. All about that collaboration. Chris, I'm going to start this question off with you. Are the programs that you work with, the programs that you developed, is it just state specific? Because this particular person that asked this question, it's their first opportunity hearing about foster youth mentoring opportunities other than CASAs.
Absolutely. So yes, we designed this in Vermont, but it is not just state specific for Vermont. You're more than welcome to come up to Vermont if you want to know more about it, or come visit our program. We actually have CASAs here, so court-appointed special advocates, I think it's called. We do have those here in Vermont as well. That is a different program. We do work very closely with them. But really, what we do is, we serve youth from 5 to 25, and so we have a huge age range. But we also really want to make sure that we're supporting youth in that one-on-one mentor match to provide them support long-term. And so although, a lot of our youth, a lot of CASAs tend to be for younger youth here in the Vermont area. And so I would have to say most of them, if we work together with them, it tends to be the kind of elementary school age youth that when we provide them a mentor. But we do have many collaborations where they have a court-appointed special advocate and a mentor as well. And both of those people work hand in hand to provide support for that youth. And so we'll work with a lot of different programs and a lot of different partners to just really support youth as much as possible.
That's awesome. Thank you so much, Chris. Carmi, can you speak to state or national focus for your program?
Yeah, absolutely. So our program is not state focused. We have, in our 26 years, again, been able to replicate our program across the country and into the UK, and we're continuing to look at expansion possibilities to expand in other cities and in other states. We pretty much, again, have our core logic model that we follow, and then we're able to then replicate it into really anywhere in the world. I'm ready to go to Jamaica, honestly.
I appreciate that. I'll go too. So thank you so much for that. Leah, obviously I know you're local to Massachusetts, so what I would like to start out with you is asking about measurement. How have you evaluated the effectiveness of the mentoring programs that you work with? I'll start with Leah, and then I'll go on to Chris after.
Sure. We so for each program, again, it's a little bit different. I feel like a broken record, but for our Big Friends Little Friends program, for instance, which used to be Big Brothers Big Sisters, I was actually on board 10 years ago when we made our transition and became a program of family services. So I brought a lot of the information, the sort of, the experiences that I had. So, so we modeled our evaluation off of theirs, and we conduct an annual survey for all of our participants, mentors, parents, and youth for that program. And so it's self-reporting. And pretty similar as far as our other programs go. We survey on an annual basis. We do a mid-year survey as well, which is more of a satisfaction survey and making sure that we're doing our very best to serve our participants and stakeholders. So for Success Mentors and and Amigos, we look at data. We look at information that we receive, on attendance from the schools. We look at, the court is helpful as a partner. So we we measure court involvement or arrests, and and we ask those kinds of questions as far as to track recidivism and to see if our program is working in the way that we intend it to. So it varies. A lot of evaluation going on though.
Awesome. Thank you so much. Chris, how do you evaluate for success?
So very similar to Leah and probably Carmi, we do annual surveys as well of all of our youth, both at intake and then annually while they're here. Our average mentor match is just over 4 years. And so we know that we're going to have a good amount of data with each match that comes to us. But we use the Developmental Asset Survey, so and that's through the Search Institute. So we survey on the developmental assets. Our ultimate goal is to increase by 20%. We increase protective factors. We also do we survey to make sure that they reduce drug and alcohol abuse, criminal behavior, that youth graduate on time within 6 months of graduation, are enlisted in the military or a service in full-time education or in workforce with advancement opportunities. And then the last is that we work with their school to make sure that they have the Vermont Department of Education's transferable skills, which is just a list of skills that the Department of Education here says that if youth have these skills, they're going to be successful in the workforce. So we actually work with them on those. So it's a whole bunch of different avenues that we look for surveying, but we do those traditional surveys. We also do focus groups as well, just to make sure that that youth are happy in the program and that they're supported. So those focus groups are often by a board member that we have that comes in and does those, and then we also have focus groups for mentors, just to make sure that mentors are supported through our program as well.
Great, thank you so much, Chris. And now I'm going to toss it over to you, Carmi.
Yeah, earlier in the slide, in the deck, I believe it's slide 28, I shared a number of studies that we have, some ongoing and some that have already concluded to really measure the effectiveness of our program. So I won't necessarily go into detail, but yes, we do the annual evaluation. We do a number of other research studies on the effectiveness of our program. I did mention the program performance scorecard. And so this is, we have a monthly scorecard that is produced, a quarterly as well as an annual. And the data points that feed into this scorecard come from either the weekly collection of data that the friends are inputting, depending on if it's, again, our monthly scorecard, as well as information we gather from the schools. We have partnerships and data sharing agreements with most of our school districts where we're able to feed in information that ties to our intermediate and long-term outcomes. So we have 5 intermediate outcomes that we collect data around. The first one is school success. And so with that one, we look at successful course performance. We look at absences and tardies and suspensions. We look at, and with successful course performance, we're looking at GPA and for the younger kids, whether they're on level with their reading and math. The second intermediate outcome is our making good choices. And that one is a little broader. We take a look at their avoidance of risky behaviors like, drug and alcohol use, the use of birth control, even for our little ones like crossing the street safely. We also consider in our making the choices the involvement in extracurricular activities, because we know if they're involved in extracurricular activities, they're less likely to be involved in other riskier behaviors. Our third one is improve health. And in that one, we look at healthy nutrition as well as physical activity on a weekly basis. Our fourth one is plans and skills for the future. And with that one, we measure things around attaining skills for safety and independence for their future. And then our fifth one and final intermediate outcome is our social and emotional development, where we look at things like how they're developing relationships with supportive peers and adults. So we again are measuring those things on a weekly, monthly, and annual basis, and we're able to collect data from our youth that are third grade and over. They do a survey at the end of the year, as well as the Friends are doing a survey on the youth around their progression, around the goals that are set for each of those intermediate outcomes yearly. We set individual goals for each of our youth that fall under each of the 5 intermediate outcomes, and then all of that then feeds into the 3 long-term outcomes that I shared earlier around graduating high school, avoiding the juvenile justice system, and avoiding early parenting. So lots of different ways that we're measuring the success of our program.
That's amazing. And a quick follow-up question to each of you 3. What data management system, if you don't mind sharing, do you use to collect all this data?
This is Carmine. So, okay. Yeah, we use Efforts to Outcomes. ETO is the acronym, is the data management system that we use.
Perfect. Chris, do you mind sharing?
Absolutely. We used to use Civicor, and we're now moving to innovative mentoring systems.
Okay, great. And Leah?
Yes, we use MentorCore through Civicor as our primary data management system, mostly to track demographics, matches, match support notes, all of those things. We use SurveyMonkey as well for for a lot of our surveys. So we find that to be just a really user-friendly tool, to be honest. So.
Oh, I hear that. And we are getting down on time, but I really would like to, there was a great question about involvement of the entire family. Quickly, I would love to hear from each one of you just a quick snippet of how you, engage the entire family in that mentoring relationship. Start with Leah.
Sure, yeah. So like I mentioned, we involve parents and caregivers from the start in the enrollment process, the matching process. We invite them to our kickoff events, any event that we have. We contact them on a regular basis through match support. We encourage ongoing communication between the mentors and the parents as well, and we serve as a bridge for that communication. So sometimes mentors won't feel completely comfortable talking about everything directly with the parents, especially if they're having challenges. So that's what our role is.
Great, thank you. Carmine, do you have any tips?
Yes, so we are again, our program is voluntary. So we meet with the parents prior to matching the youth with a mentor, and we get to learn, the parents. We always ask, what are your hopes and dreams for your child? So we start from the very beginning, letting that parent know that, we're A, not trying to replace you as a parent, and B, we really want your input around your child. And so as we set our goals annually, we work with the families to set goals, youth-led. However, we absolutely talk to the families around what are some of the hopes and dreams that they have, and what are goals that are appropriate for your child. Here's what I think, but what do you think as a parent? And so we also, in addition to our intermediate and long-term outcomes, I didn't mention, we have what we coin them our core assets, these 9 social and emotional learning skills that we teach our youth, and as we're working with our youth, we are also working with the families around. And so we're constantly looking at ways to involve the family, and not necessarily for this call, but we actually have a third child selection process where we are selecting what we call our 2-generational approach. We're selecting the young minor children of young adults that experience foster care that are parenting. So the parent experienced foster care at some point in their life. We are now mentoring their young children as well as the parents. So we're mentoring both generations in 2 of our locations now. So we are continuing to move into a space of serving the entire family more, with the focus being on the one-on-one relationship with the youth.
Awesome. Thank you so much. And I am realizing we're getting down to time, but I still want to ask Chris. Chris, do you have tips and tricks for that?
Absolutely. So we do, so obviously our family mentoring program, we work very closely with the family, but apart from that, we work with the family basically every month. We check in with the family, make sure that they're doing well. We provide a lot of assistance. What tends to happen is that when families go into crisis, that affects the mentor match, and so therefore we try to work as closely as we can with the family on the coordinator level so that we know that if there's a crisis coming up, that we can kind of step in as an organization and provide support or community referrals so that the mentor match isn't affected, because if they go into crisis, the mentor is going to be one of the first calls for assistance, and oftentimes it really pushes on those boundaries for those mentors. So we just want to make sure that we're always there providing that support.
So perfect. Thank you so much. And I have put in a couple of times into the chat pod about the National Mentoring Resource Center. Please, reach out to us for that, for free resources, for free training and technical assistance, consulting. All these, the presenters, we just want to thank you so much for sharing your time, your knowledge, and this valuable information with us. They have agreed to share emails, the slides. I know the scorecard has been asked about a couple of times. The slides will be able to be shared after, so you'll be able to see that. And so, yeah, I'm going to turn it back over to the NTAC folks to close us out. Thank you all again so much.
Hey, thank you very much. I appreciate you, Melissa. And thank you again to our presenters. We just have a few brief announcements to keep in mind before we wrap up. You may contact NTTAC through the website displayed on this slide. You can stay up to date on the latest information, sign up for NTTAC's TTA listserv. Also, don't forget to check us out on Facebook at OJJDP NTTA. You can also contact OJJDP, the help desk, by the following contact information on this slide. And do you have training and technical assistance need? Please submit a request via the Help OJJDP TTA 360 platform through the link displayed on this slide. Just as a reminder, the webinar recording will be archived and on NTTAC's YouTube channel, where you can also view past webinars. For event transcript and supporting materials, contact the OJJDP Help Desk. Please take a moment to review the disclaimer here. And lastly, we would appreciate if you all could take about 5 minutes to complete the feedback evaluation survey. Again, thank you all for joining us today. Have a good afternoon.
The host has